Welcome to today's edition of Mental Health Matters. Today we're going to be talking about COVID-19. This is going to be part one with Dr. Abshire. So get you something to drink, get you a snack, and come on back because we got a great show ahead for you guys. So, welcome back to the show, Dr. Abshire. Why don't we just start by you just kind of reintroducing yourself to our audience and just kind of let us know what you've been doing since the last time you was on the show.
Great. Thank you for having me here today, Jesse. And I'm a internal medicine physician, a general internal medicine physician here in Sacramento. See a whole gamut of patients from 18 to 100 something, and from all walks of life, rich, poor, men, women, the whole gamut of internal medicine, which is general adult health. I've written a book called Live, Love, and Let Go,
Yes.
Which is a perspective on trying to keep a positive, proactive approach to end-of-life issues as well as other difficult areas in people's lives. And I've been going out and having talks, like little seminars to various groups around town and even in some other states, and trying to give them a positive approach to dealing with tough times like this. Yeah.
So I want to piggyback. You know, it's interesting because I actually forgot. I read your book and actually forgot about that. Man. So it is geared toward. So just talk a little bit about your book. Just give a little bit of detail so that the audience can know.
Right. So deal with the whole gamut of end-of-life issues, dealing with fear, hope, pain, suffering, hospice care, end-of-life issues, and trying to keep a positive approach throughout the book, and talking about from both the patient's perspective, and I also write from the family caregiver's perspective.
You know what? This is so interesting. I just had a friend of mine, my close friend, mom, just passed away from stage 4 cancer. We just had the funeral on Wednesday, and so the family was her caretakers. And your book would have been absolutely right on for them. It would have been something good for them to read. You know, as a matter of fact, I still might just have you just send me some copies and where I can just give it to them. I think it would help them because they're going through a really rough time now.
Right.
So yeah, wow, okay. I didn't think about that.
Yeah, right, yeah. And so I actually have non-Hodgkin's lymphoma myself, and I'm in remission and doing well, but so I've got perspective on dealing things from both sides of the white coat, if you will.
Yeah. So yeah, I think I'm we'll talk offline about that. But I'm gonna reach out to where you can give me some copies. I can give it to them, and I think that and all of them are in the medical field.
Oh, great!
All her kids are in the medical. She has 5 kids, and all of them in the medical field.
Yeah, wonderful.
So this will be beneficial to them.
Yeah.
So how long have you been practicing medicine?
Well, really, I graduated from medical school in 1990.
Okay, wow.
So
It's
really
been a while.
40 years now.
Well, that's been a
Yeah,
while.
right.
So, I'm going to say this because I want to bring this out too, because your wife just let us kind of communicate this before we started, that you was an engineer before you started practicing.
Correct.
Yeah.
I was a senior chemical engineer once upon a time in my formal life. I've also worked flipping hamburgers, tossing pizza,
Yeah.
and even selling vacuum cleaners door to door.
You are a jack of all trades. So what made you want to make that switch from being an engineer to practicing medicine?
Well, it was actually back in the 80s, and they were going through a recession, and so they had layoffs at the chemical plant I was working at. And fortunately, I didn't get laid off, but all of the projects kind of dried up, and so I got to sort of just looking around at other opportunities. I think there's actually a lot of similarities in thought processes
Nice.
between engineering and medicine, and medicine's a fascinating field, and you can't get bored doing this.
Yes, absolutely.
Yeah.
So did you have to, so how much more, because this is just my own personal curiosity,
Yeah.
how much more schooling did you have to go through to make that transition?
Yeah, I went through a couple years of night classes just to pick up on some biology courses and things that I need to do just to get into medical school that I didn't have from my other undergraduate life.
Nice.
And then 4 years of medical school, intensive training, and then 3 years of residency, which
Oh, wow.
I did that at UC Davis, and I did my medical school at Southwestern Medical School in Dallas.
Nice, very, very impressive.
Yeah.
So let's get on to the matter at hand. We're going to be talking about the COVID-19 epidemic. So I guess I can just start off and ask you, what is a virus? What are viruses?
Viruses are microscopic particles that cause an infection in people.
Okay.
In a nutshell, yeah.
Yeah. So we know that we are now dealing with the COVID-19 pandemic. Well, let's talk about what is that?
Well, the coronavirus is a family of viruses, and apparently there was a mutation somewhere along the line of one of the coronaviruses that developed into this certain viral particle, which has obviously caused a lot of mayhem across the globe. And they eventually changed the name, and they call it the COVID-19.
Yeah.
From because they wanted to distinguish it from other coronavirus particles. Several of the coronavirus particles actually are just responsible for causing the common cold in people, which I'm sure most people have had at some point in their life.
Yes,
yes.
yes.
And so they're wanting to distinguish it from the common cold virus, and so they named it COVID-19, which I think is coronavirus,
Yeah.
from the year 2019.
Yeah.
Yeah.
You know, I remember last year, especially like towards the end of last year, a lot of people were getting sick. I mean, just people just getting sick. And so I remember talking to one person, and he started telling me that he think that he had this last year.
That's certainly, we've been getting lots and lots of questions about that. I know several people in our office think they may have had it in December. There certainly was something that went through in December where a lot of people were out sick with it. I actually saw an article this morning where they think in France there may have actually been some cases back as far as November in France.
Yeah.
And we typically think of the virus as originating in Wuhan, China.
Yeah.
But it may have been spread around the globe probably long before we ever knew about it.
Yeah.
And so certainly there are a lot of people that think they may have already gotten it.
Yeah.
Yeah.
I know when I first heard about it, it being in China, I didn't pay too much attention to it. I didn't really care at the time, to be honest with you, because it wasn't here in America. It wasn't something that was in my backyard, so to speak, and it wasn't a big deal to me.
Right.
And so I for some reason, I started to hear more and more about it, being more exposed to it, you know, the virus traveling to different countries and different places. And so when it came over to America, it was just like a radar. And it's like it just all happened so fast, you know. And so how did it affect you and your patients that you're currently seeing now?
Right. Well, particularly when the shutdown went into place, it greatly affected how the practice was done. So we started doing telemedicine visits and phone visits, and initially really encouraging people to try to stay home initially, and we're starting to open up with that again now.
Oh, okay.
We were, but they shut down any kind of elective procedures in the hospital, so knee replacements and all of those sorts of things stopped happening. So it was a huge effect, and certainly a lot of people out there being scared.
Yeah, absolutely.
And having to deal with it and being isolated from everybody else too. So yeah.
So are you guys doing like a slow transition back?
We're slowly transitioning back.
Yeah.
So right now in the office, I'm probably seeing half of the patients in the office or so, and then half of them some sort of a virtual visit.
Yeah.
So
Wow,
correct.
that's pretty scary.
Yeah.
Did have you been dealing with a lot of that with the people you see, or meaning your clients, your patients?
Well, everybody has questions about it.
Yeah.
If we're talking about the virus itself, fortunately here in Sacramento so far, knock on wood, we've been blessed in terms of the virus not being as bad as in some of the other big cities and areas around the world. So I've actually just had one patient that had it and was very sick with it, but unfortunately he survived. And,
But that's good.
but everybody else has been worried about it. I've got many patients that think they may have had it at some point earlier in the year, and certainly early in the year I had many patients that, in retrospect, I think probably had it just based on their symptoms. Unfortunately, they did okay with it, but we do wonder.
Yeah. You know what's interesting is there was a lot of anticipation about the homeless population being greatly affected with the virus. I know when they and this was actually before they did the quarantine here in Sacramento. People were anticipating that the homeless population was going to be affected with the coronavirus, and they thought there was going to be a large quantity of people. But what I'm finding out now is not a lot of homeless people is being exposed to it, or at least, I don't know if they're tested or not, but there was some research done that a lot of homeless population here in Sacramento have not been exposed to it. And I'm wondering, is it due to them being out in the air?
That's a great question, and certainly there's a lot of speculation about it. Certainly they've done some studies that ultraviolet light are bad for the virus, and basically kill the virus. And if you look at a map of the U.S., really the Sun Belt states have done much better. The Sun Belt states, except for really two exceptions. One being New Orleans. And New Orleans, people tend to sleep all day and party all night, if you will. So that's like sort of not being part of the Sun Belt. And then the other exception is unfortunate patients in nursing home beds. And basically isolated and locked up in their nursing home rooms, which again is not being out and getting as much of the fresh air and sunshine. So certainly there's speculation whether the ultraviolet light's helping the homeless, which certainly would be a blessing. We talked a little bit about how things that you can do to strengthen your immune system, and things that weaken the immune system. I know we kind of talked about people or studies are showing that, and you can correct me on this, but about how actually staying inside actually weakens your immune system opposed to going out. Speak to that, where people can kind of understand. Yeah, right. So if you will, there's kind of two schools of thought on the virus. In the ideal situation in terms of fighting the virus, you would basically want everybody to totally hibernate and totally isolate from the whole rest of society, and if there's nobody else around you, then you're not going to get it. I'm afraid that fear is, they're using some fear to stimulate people to really want to socially isolate and motivate them to socially isolate.
Yeah.
However, social isolation has been shown to have morbidity and mortality in of itself.
Yeah. Wow.
And so actually they've done studies on social isolation, and they see that people that are socially isolated actually have increased mortality. And actually rivals being on par with, we know blood pressure, obesity, and smoking, for instance, are bad things for people. Really, social isolation in terms of mortality, all-cause mortality, social isolation rivals those other areas. So, so certainly when you tell somebody to socially isolate, it's good from the virus standpoint, but it's not good from their health standpoint. Just like telling somebody to smoke would be a bad thing for their total health standpoint. So people who are isolated have increased risk of other problems. They get more depressed. We're seeing, suicidal ideation, for instance, is way up. And social isolation will increase cardiovascular disease, so risk for heart attack and stroke. It weakens our immune system. So eventually, if you are exposed to whether it's the COVID virus or other infectious disease, your immune system is going to be weakened, and you're going to not do as well with it as well. So
Wow.
Yeah.
I know that this kind of jumping around a bit, but I was reading online that a lot of people, relationships are now being affected as well, because people are around each other 24-hour a day, and even like certain parents have to be at home and homeschool their kids, and that's causing a lot of anxiety and just things that parents would normally do on a daily basis, 5 days a week at least. So what are some of the things that, let's speak to the couples first. What are some of the things that couples, marriages can do to survive this, because they are around their spouses 25 hours a day, 7 days a week. And
right, and that's a tough thing. So when people have lost their jobs, we're seeing alcoholism and drug abuse is up. The little kids being home from school. I remember growing up, and I was in the Northeast growing up. And we would have these snow days, and snow days were great because you get to go out and play in the snow with your friends. So this is kind of the equivalent of a snow day, except they can't go out and play with their friends, and so they're home driving their parents crazy, if you will. And people are drinking more and more irritable, and I'm afraid that child abuse and domestic abuse is up. I've heard of one couple that was engaged, and they were living with each other, and after being with each other 24/7, they decided that they didn't want to be with each other 24/7 anymore, which was certainly unfortunate. So certainly trying to be able to get out, and I think people need to have a positive purpose to their life. You need to be able to develop a sense of accomplishment and having a purpose to your life. Psychologist Viktor Frankl was a Holocaust survivor from Auschwitz. So he wrote about having the prisoners that survived the camp weren't necessarily the ones that were strongest physically, but they were strongest mentally. And what he felt made them the strongest mentally was as they developed a positive purpose to their life. So for Frankl, his positive purpose was wanting to stay alive so he can see his wife again. And so certainly you need to have a positive purpose to your life.
Yeah.
And so when people are told they don't have a job, they don't have an occupation anymore,
Yeah.
what are they to do? So I would encourage people to try to be creative.
Yes.
I do see, people, I've got some patients that have been making face masks
Yes.
for us, and so I think this is just a wonderful thing to see, but having a positive purpose to their life, I think, is really key.
Yeah.
And so they may be creative in terms of what that might mean from various standpoints, but I know people are trying to help out and help each other and that sort of thing, so I think that's really key.
Yeah, I have a friend who lives in Chicago, and one of the things that I encourage her to do is to work on her business plan, 'cause she always wants to start a transportation business geared towards the older adult population. So she was able to put her business plan on paper. She got business cards, she got another phone. I mean, like, she's literally just sat down and created her whole business plan over this quarantine period. So I think, to speak to what you said, I think that is a good idea, that people do find purpose and work on their goals and whatever they feel that can get them through, because if we sit around and just kind of focus on that, and people do need jobs to pay bills and things like that, but you can find other ways to get through this than focus on the negativity or focus on the negative way that it's affecting you as an individual.
Yeah, definitely try to find something positive to do.
Yeah. So, in your opinion, what would be the pros and the cons? And this may be asking, you may be kind of speaking to on the same thing, but what would be the pros and cons to this pandemic? Like, because I always tend to think that you can get sunshine out of darkness some way, somehow. I'm a believer in that. They said we've been enduring for a night, but joy comes in the morning. So what's the pros and cons to this, in your opinion?
Yeah. The cons are obvious. People are dying, people are losing jobs, economic strife, people arguing with each other, so the cons are obvious. The pros, I think, are much more subtle, but I think they can be really powerful if we can try to really go after it, if you will. So certainly when I see people being creative, and trying to do positive things, for instance, making face masks, or your friend working on a business. So those would certainly be positive things to do. There's really three things that I like to try to stress to people. And these are three things that actually can strengthen your immune system, if you will. And I think they're very positive, and if we can get people to turn and look towards the positive, rather than focus on the negative with the virus, then that would be a huge win. So the three things, humor is great, and so I'm seeing people are sending little jokes and funny videos and things over the internet, and so trying to find something to laugh at and trying to look on the lighter side of things. So people who seek humor, it's actually laughter is equivalent to exercise. So 1 minute of laughter is actually 10 minutes on a rowing machine, for instance. People who seek laughter do better in terms of cardiovascular problems, and it also strengthens the immune system with laughter. The other thing is gratitude. And so trying to find something positive in a dark situation and giving gratitude for that. And gratitude also strengthens our immune system. People who find gratitude live longer, and it probably actually makes them sharper mentally. It decreases pain levels, and they're less likely to be sick. So I really encourage people to try and focus and find something that they can be grateful for.
I can see that
in this dark situation. And I actually encourage people even to do gratitude journals. So where you write down like 5 things every day that you're grateful for, and that kind of trains your mind to look towards the positive.
Yeah.
And that helps to train yourself to pull away from dwelling on the negative.
Yeah, it's interesting you said that because that is really my way of thinking. What that does for me, it releases me from being able to try to control something that I really don't have any control of. And I give an example. My family members, I'm from Chicago, Illinois, and on my way here, I was talking to my mom on the phone, and yesterday was her birthday, and she was telling me just a lot of stuff in the family and stuff. And so I was thinking to myself, just a lot of negative stuff that was going on in the family. And I was thinking to myself, well, I have no control of that. Like, I have no control of that. People are living their lives the way they want to live their lives. They're doing the things they want to do. And I'm just grateful that they're alive. I'm grateful that I'm alive. And, and I really was thinking like that when I was driving here, And so I try to keep myself in that space, because there are things that's going on in life that I truly cannot control. I can't control this pandemic, you know what I'm saying? But there are things that I can do for myself to keep myself in a healthy space, or keep myself safe. But I'm alive,
Right.
And that's the way I try to think, so to speak.
Right. So, and if you can focus on the positive, you're going to do way much better than if you dwell on the negative.
Yeah.
The other thing, along with humor and gratitude, is the concept of forgiveness.
Wow.
Which I think is huge.
Yeah.
The converse of forgiveness is unforgiveness.
Yeah.
And unforgiveness increases stress on our body, makes us unhappy. We see people that are dwelling on unforgiveness. They do worse, again, from cardiovascular standpoint. They do worse from a cancer standpoint. They do worse from a chronic pain standpoint. And their immune system is weakened.
Yeah.
And if you can seek forgiveness, and oftentimes is wanting to forgive yourself, but forgiving others.
Yeah.
And unfortunately, in these times, it can be really disturbing to pay attention to the news, because people are blaming each other back and forth. And hopefully people can come out of this pandemic and learn to forgive each other.
Yeah.
And when you forgive somebody, number one, you help them out so they don't feel guilty.
Yeah.
But number two, when you forgive someone, the person you help the most is yourself.
Correct. That's exactly right.
From a health standpoint, because again, your immune system is improved, it's released all of that anger and tension, your blood pressure is going to do better, you're just going to be feeling better and be overall happier.
Yeah.
So if people can look at the pandemic, kind of getting back to your question, and trying to turn and say, hey, what can I do positive to try and combat this thing? And seeking out positive things, the humor, the gratitude, the forgiveness, finding something positive to do with their life. That's really the key, and I think really where we need to move heading forward.
Yeah, and I'm glad you brought that up too, because those are, things that personally I've never thought about. The unforgiveness and finding things positive, and some of these things I do naturally. But I just just don't think about that, because you're so focused on.
They're really blessings, I think.
Yeah.
Positive things that we've been given, but we really don't realize the magnitude of how good of things these really are. And I think when you realize from a physiologic standpoint, in other words, how is it going to make our body work better? How is it going to help open up our blood vessels? How is it going to make our immune system work better? These are things that I don't think are common knowledge out there in society. And if we can realize these things and then really seek them out, so seeking out humor, really looking for the positive in a negative situation and being grateful for that, and then learning and working to forgive people from whatever standpoint that might be coming from. We're just going to be better off from health-wise And then the other big thing is we'll be happier.
Yes, correct.
So that's a big part of living is being happier.
Yeah.
And these things will help with that as well.
Yeah. Let's talk about the fear component of this. Because I feel like fear is causing people to overreact. I feel like fear is causing people to have a negative way of thinking. I think fear is causing people obviously to be isolated. It's putting people in a state of mind where I feel, this is just my own personal opinion, where people are self-absorbed. Like they only focusing on, because you may see somebody who may need to hear a kind word, or because to me I think sometimes if you say good morning to somebody or hello, that sets the tone for somebody else's day. But I think sometimes if you're just so focused on let me go get this and boom 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 back in the house, you don't really have time to be social while you're out, or if that makes sense to you.
Right. So there is a lot of fear that's being used, and I think some of the motivation of it is to try to motivate people to want to socially isolate
Right.
and stay away from the virus, and I understand that looking at it, but what the fear does is makes, I know of people that are haven't left their home in 2 months, and it's kind of sad to see, and so again, where you find in the life, the zest in life, the happiness, the joy of life if you're hibernating like that, and fear again weakens your immune system, again makes your cardiovascular system worse. You're going to be more predisposed towards cancers and other diseases, and so when an infectious disease comes along and you've been living with fear and isolation, it's actually going to be making you more susceptible when you're getting hit by it.
Wow. For me, I use going to Costco or Walmart just to get my essentials. I use that to kind of get out the house. Sometimes I go for walks around my block. I go for drives, and I just can't stand there that long, 25 hours. I need to get out. I need,
Right. Yeah, I certainly encourage people to try and get out, get fresh air, sunshine, and try as best they can to socialize with other people. We're social animals, or beings, if you will, and we need to socialize, and that's what's healthy for us.
Yeah, exactly.
And to live in fear and isolation is not healthy. So we need to try to find the happy medium there and seek that.
Okay. Yeah. Thank you for watching our show. If you would like to be a guest on the show, if you would like a DVD copy of the show, or if you would just like to learn more about Mental Health Matters, please dial 916-366-4600. Thank you.